Hi, my name's Tim Allardyce. I'm a registered osteopath and chartered physiotherapist, and I work at Croydon Physiotherapy. The shoulder joint is an enormously complex joint. It has a very wide range of movement, and this can put the ligaments and the muscles around the joint under a lot of strain. The shoulder joint is also very susceptible to posture and work ergonomics, so it's very easy to get a repetitive strain or a work-related injury to the shoulder. When you present to a physiotherapist, first of all, we'll make an assessment. We'll probably ask you to lift your arms above your head, backwards, sideways. We'll look at how much movement you've got with your shoulder. We'll then lift your arm up ourselves and feel the actual shoulder joint to see if we can work out exactly what the problem is. Acute shoulder pain usually settles down quite quickly with treatment and anti-inflammatories. We can get the shoulder moving quite quickly and you can get a good response to treatment, sometimes within a few sessions. More chronic shoulder pain is often more difficult to treat, and that's because the shoulder pain's been going on a lot longer. There can be other issues involved with the shoulder, such as wear and tear or arthritis in one or two of the small joints around the shoulder. My advice to people with shoulder pain is if you do exercises on the shoulder, make sure you're given those exercises by a physiotherapist so they can accurately give you the exercises which are right for your shoulder. A lot of people come and see us and decide to do their own exercises using gym equipment, and often this just makes the problem worse. So it's important to maintain good form when you're doing the exercise and to do the exercises exactly as they've been shown. The second piece of advice I'd give is to use ice or ice and heat on the shoulder. There are many inflammatory conditions which affect the shoulder. 3 times a day, 5 minutes of frozen peas or an ice bag wrapped in a frozen tea towel across the top of the shoulder should be enough to reduce your symptoms within a couple of weeks. Some people prefer to use heat, and heat can work equally well, and it's maybe worth experimenting between the ice and the heat to see what works for you. But a hot water bottle on the tip of the shoulder wrapped in a tea towel can be excellent. 20 minutes 2 to 3 times a day. Posture is so important for shoulder problems. A lot of us slouch at work. We are generally sedentary based, and we tend to roll our shoulders forward and bring our neck forwards, which puts the shoulder in a particularly vulnerable position. There's a very high correlation between shoulder pain and poor posture. So just keeping the shoulders gently back, maintaining good upright posture, addressing any slouching at work can make a big difference to your shoulder pain.